Good afternoon. Can you all hear me? My name is Melissa Garthwait, and I'm a resource coordinator with Hartford Healthcare Center for Healthy Aging. Thank you for joining me. I know it is 2 o'clock in the afternoon on a Friday, no less. So grab some coffee or a cold drink and let's get into navigating the what ifs, a roadmap to aging services. Today, we're going to be presenting information that is for educational purposes only. This is never a substitute for a medical appointment or medical treatment. If you need a doctor, go see your physician or call 911. So today, we're going to start our presentation with talking about some housing choices, care options, preparing for the future, and how the Hartford Healthcare Center for Healthy Aging can help with all of that. So why does this matter? We've talked a lot today about being proactive rather than reactive, not operating out of panic. We're able to make so many more informed decisions when we allow ourselves time and we're not operating in panic mode. One minute, please. I'm sorry. I know you're having trouble with my volume. Give me 1 minute. No. I'm hoping you guys can hear me better now. Is that better?
Yeah, that's definitely better.
I'm so sorry about that. So, meeting.
Watch your video though. All right, you're good. There we go.
Okay. Sorry about that. So, you may have seen this pyramid before, and we're going to talk about hierarchy of needs. So when we're talking about the hierarchy of needs, we're talking about at the bottom, basic needs, physiological needs, food, shelter, care sources. Then we go to safety. Safety looks at eligibility for home care, safety devices in the home, different funding sources that will help make the environment safe for our loved one. Then we look at socialization. We all saw, especially during the pandemic, how lack of socialization really affected people. So how can we help people stay engaged, whether it's through support groups, lunch and learns, or family forums? Moving up, we want to get to optimal self-esteem. And how do we do that? We can do that with disease-specific education. We can help people learn about their diseases, whether it's Alzheimer's or other dementias. We can help them learn about the different payer sources that are out there. Knowledge is power, and it helps us to feel stronger and have a greater sense of self. And as we get to the top, the goal of all of this is to reach healthy living, optimal healthy living. I'm hoping that you can still hear me.
I can still hear you. You're good.
Okay, great. Housing options. So let's talk about the different options that are out there. Aging in place or moving to another setting. So what are some of the benefits of staying in our home? Well, it's the place that we've raised our family. It's where our memories are. It's where many of us have raised children. We have established routines there. We have a sense of community. We have neighbors. We have church groups. It's where we have made our life's history. What are some of the challenges? Well, maybe that home that we love is no longer the best spot for us to be in. Maybe it's too big, or the expenses are too great. Maybe it's too difficult to maintain. Maybe it's unsafe, or maybe it's just too isolating. So some factors to consider for aging in place. Safety. There are so many technological advances as far as devices that can increase home safety. We're talking about things like personal emergency response systems, medication dispensers, different wandering prevention options, home modifications, whether it's putting a ramp outside or grab bars in the bathroom. Financially, we need to look at, is it still affordable to be here? And if we are going to stay, what types of assistance may we need to stay? Whether it's transportation, meal services like Meals on Wheels or others, maybe getting help with the yard work, or bill paying, or developing a support system. What are options to consider if we do have to move? Maybe we think about downsizing. And what are the logistics of that? Is it going into a smaller house or a condominium? Should we get on wait lists for apartments or subsidized communities? One thing that I will pause to say is I cannot stress enough, housing right now in Connecticut, and I'm sure across the country, is a crucial issue. And getting on wait lists is a fantastic idea because some of them are a year or more. And I think a lot of people don't realize that. Is moving in with family an option? And I chuckle at this because a lot of times our loved ones may feel it's an option, but we may not feel the same way. Is it feasible for all parties involved? And what would be involved in that process? So we're going to talk about some options. I'm going to talk about something called a continuing care retirement community, or a CCRC. So this is a community that offers independent living, assisted living, and skilled nursing all on one campus, or all in one community. The value of this is it does guarantee a spot in all these different levels of care. There is a cost factor to consider. Generally, there's a buy-in that starts at $200,000, and depending on the area and the facility or the community, that can go up. And there is also a monthly fee associated with this, which can start at about $2,000 and go up, again, depending on the community. Assisted living facilities. So an assisted living facility is a community that gives older people personalized care in a residential setting. They start generally at about $5,000 to $7,000 a month, and then they go up depending on what your needs are. So my dad, who is going to be 92 in February, is in an assisted living. During the pandemic, we lost my mom, and he had to move into a facility because even though he had all his faculties, he couldn't boil water. Those were the tasks that my mother did, and he needed to go someplace else. So we looked at assisted living as an option. Right now, he's independent, meaning that he has his own apartment. He goes down for beautiful meals. He takes a full range of activities he takes advantage of. However, if he gets to the point where he needs assistance, there will be a change in cost. Think of it as an a la carte menu, if you will. You can add on services as needed. So if he needed help with showering, we could pay an extra fee monthly to get that. If he needed help with medication, you get the idea. You can add on. There are some subsidized assisted livings in our state, but there's only a few, and I'm not even going to really get into this because the waiting lists are very long. The next option we're going to talk about is a residential care home. You may also know that as a rest home. I know I'm in Litchfield County and we have one, and it is a rest home. Same thing, residential care home. Supportive settings for basically an independent senior who just needs some support with personal care, supervision, maybe some monitoring with medication. The cost is around $200 a day, and it is either self-pay or Medicaid. And now we're going to move on to a skilled nursing facility. Many people know skilled nursing facilities. They may still refer to it as, I know my dad does, a convalescent home. Skilled nursing facilities are able to provide a skilled level of care. When I'm referring to a skilled level of care, I just want to take a moment. Skilled being a registered nurse, physical therapist, occupational therapist, speech therapist, skilled care that the state has determined that someone could get in this facility. Now that can be short term, as if somebody goes into the hospital, maybe has a hip or knee surgery and then needs to go to a facility for a short-term rehab stay. And that can also be long-term. The general cost for most skilled nursing facilities in Connecticut right now averages at around $600 a day. That comes out to about $18,000 to $20,000 per month. Now, many people can't sustain that. So although they may start as self-pay, many people end up going on Medicaid, which is also known as Title 19. And a lot of people may also have long-term care insurance, which depending on the policy, and each policy is very different, can offset the cost of skilled nursing care. So care options. Who does what? How much is it going to cost me, and who pays for it? So let's start with visiting nurse services. These are certified nursing services in the home that are covered by Medicare. This is a short term, again, going back to that skilled need, registered nurse, physical therapist, occupational therapist. This can also include palliative and hospice care in the home. Payment options for this are health insurance based, Medicare or another health insurance product. Then we're going to move over to non-skilled companion, homemaker, health aid care at home. This is non-medical, non-skilled, meaning you're going to have a personal care assistant that can be a live-in or an hourly, or you may have what's known as a companion homemaker who can be there just for companionship or provide light housekeeping. Payment options for this are self-pay, some long-term care insurance, some state programs also will cover this, as well as grants. Some people may have heard of the Connecticut Home Care Program for Elders. That is what I'm talking about, not only, but one of the programs that will pay for this care in the home. And then we move over to geriatric care management. This is intensive care management that oversees an individual's total care needs. So let's give a scenario. We have a daughter that lives in California, and we have a family member here in Connecticut. The daughter in California desperately wants to put a plan in place for her mother who's aging here in Connecticut, but obviously logistically she can't do that. She can hire, or the loved one can hire, a geriatric care manager. Now, generally, these are self-pay. Also, some long-term care insurance policies will help with this as well. So we're going to talk about a long-term care planning roadmap. So it may start at home with family, friends, and then it may move on to maybe some skilled services like we talked about, skilled home care such as Hartford Healthcare at Home or visiting nurse and hospice, other agencies. Skilled nursing in the home is speech therapy, occupational therapy, physical therapy, skilled nursing, and also that palliative and hospice care. Custodial care, that is the non-skilled care, and that is PCA, homemaker companion, and also some adult day programs. Generally, this is private pay or through state programs, grants. Also, veterans benefits can help offset this cost if someone is a veteran, and long-term care insurance as well. Somebody may need home safety devices. We talked about personal emergency response systems, automatic medication dispensers. This can be private pay, also through state programs, VA benefits, or insurance as well. Somebody may need, along the way, those home modifications. It may be putting a ramp in outside. It may be a stair lift to access a second floor. To pay for this, we pay privately or through state programs. How about durable medical equipment? Where would we go for that? Well, we can get those at many loan closets throughout the state, senior centers, and insurance or private pay is usually how one would pay for those. And a lot of these lending closets, you can get these products at a very, very low rate. Then we have Meals on Wheels. Many people may have heard about Meals on Wheels. Meals on Wheels is either private pay through grant programs or through state programs such as the Connecticut Home Care Program for Elders. Transportation, this is a big one. A lot of people are calling me and saying, how do we get to our doctor's appointments? How do I just go to Walmart? I don't drive. There are many programs around the state, such as Dial a Ride, Paratransit. It is either private pay, very, very nominal. It could be like $1.25 a ride. Also, insurance and local programs vary by regional area. Short-term rehab, skilled nursing. We talked about people that can go in for a short-term stay or a long-term stay at a skilled nursing facility. There's also a respite stay. Today, we've spoken a lot earlier today about caregivers taking care of themselves. Respite stays are a great option for that. Assisted livings also offer respite stays, and I think a lot of people don't realize that. And then advanced directives, making those plans, creating a living will where we put down what our healthcare wishes are, designating a power of attorney to deal with financial issues, having a healthcare representative to carry out our healthcare wishes that we've indicated if we're no longer able to speak to them, and planning for our end of life wishes. So continuing with our long-term options, assisted living, which many also have memory care units as part of their facility. We talked about residential care being private pay or Medicaid, and scooting back up to assisted living, generally private pay. Some long-term care policies may help with this as well. And skilled nursing facilities, private pay, and Medicaid. So how do we start this conversation? How do we have this very, very difficult conversation with our loved ones? First, we have to start with understanding that everyone's definition of quality of life is different. What's important to me may not be important to you. So we want to approach this with open-ended, non-judgmental questions. Mom, what is your goal of care? Can you tell me what your daily routine looks like? When you get up in the morning, what do you do first? How does your day flow? What are some of your biggest challenges? And we want to give the individual a moment to really consider this. This is heavy stuff. What does high quality of life look like to them? Planning for the future. So what do we do when life begins to change? We need to consider what a potential loss, not only emotionally and financially, but in every sense would mean to someone if they lost their support person. It would be a loss of income potentially of Social Security, pension, and veterans benefits. But on the flip side, what does that mean when they get a large payout from a life insurance policy? Other areas that may be potentially impacted by this loss. Who is going to now help with the yard work? My husband did all the yard work. Who's going to help me do that? How am I going to care for this house? How am I going to get to my appointments? My husband is the one who drove me. And I've just lost my best friend. How am I going to deal with that loss of companionship? So let's talk about a gift for families. Discussing and planning your wishes ahead of time is one of the greatest gifts you can give to your loved ones. Whether that means updating your will, appointing a healthcare representative, doing a living will, or having your loved one do a living will, where you put down your healthcare wishes while you're still able to convey them. Knowing who you may want to be power of attorney to handle financial matters. Exploring, is long-term care insurance something you want to look into and learn more about? This one, I need to pause. Getting names on nursing home waiting lists. I cannot stress this enough. A lot of people think, I don't need to talk about that. My loved one's going to stay home. They're not going to a nursing home. They don't want to go. I don't want them to go. And I understand that. But the best laid plans often don't work out the way we would like them to. So I encourage families that I work with to just explore some facilities, walk through, tour, get your name on waiting lists. And the thing about waiting lists that people don't understand is you can say no. They can call you and tell you that you need to, that they have a bed available, and you are able to say, I'm not ready, keep my name on the list. And you may never be ready or never need it. Setting up prepaid funeral arrangements, meeting with a qualified elder law attorney like Attorney Rubin, and creating a summary binder. So creating a summary binder. I smile every time I see this slide because I think it's such a great idea. And this is just a sample of what a summary binder may look like. You may have one section that has important documents like wills and advance directives. Maybe you have another section for marriage and death certificates or VA paperwork. I am not a veterans expert, but I do know that the DD 214 is very important. It's the golden ticket to find out if you can access veterans benefits. Side note. Another section may have insurance policies. Another one may have your financial statements. One may have safe deposit information. I didn't even know that there was such a thing as a safe deposit box until my 92-year-old father was going over everything with me and was telling me where his safe deposit box was. Bills, outstanding bills. Another one I love, account login and passwords. We live in an age of technology. What a great section to have in your binder. And the last section would be contact information, important names, who one's attorney is, their financial advisor, conservator. As I said, you can individualize this to whatever meets your needs. What's great about a summary binder is it organizes everything in one assigned place, that everything can be consolidated, things can be eliminated and just simplified. And you share this information with whoever your trusted person or people are, whether it's family members or friends, and you can update it annually or more if you need to. So where do you turn to for more information? Well, of course, you contact the Hartford Healthcare Center for Healthy Aging. I know we have covered a great deal of information so far, and I know your head may be spinning. So I'm just going to tell you a little bit about the center and how to reach out to us, because even when you leave here today, if you have questions, you'll be able to reach out to me or one of my colleagues around the state, and we can come up with a plan that works for you or your loved one. So a little background on the center: it was developed in 2004, and it was developed as a complementary resource and assessment center. And we help older adults and seniors navigate this maze of the healthcare system. We connect seniors and caregivers not only to Hartford healthcare services, but community-based resources as well. We've become a trusted, reliable, and safe resource, and we can assist adults throughout their lifespan. Our motto is we want to provide the right care at the right place at the right time to maximize an individual's quality of life. So the center serves 18 and over, but I'm going to be upfront with you and let you know our specialty is geriatrics. So I would say 40 to 100, but we can help people 18 and over. We are a complimentary service. Anyone can access our services. And as a friendly reminder, we are not a crisis center. So our team is comprised of 4 different service lines. We have resource coordinators, that is what I do. We have transitional care nurses, dementia specialists, and we also have a fantastic veterans liaison on our team. We are a motley crew. We are an eclectic mixture of backgrounds. So I'm a social worker by trade. I've been a social worker for 30 years with most of my concentration in long-term care. We have members on our team that have nursing backgrounds, recreational therapy, certified dementia practitioners, gerontology, and the list goes on. So what do I do during the day? Well, I can provide an in-home assessment, but I can also do a telephonic, virtual, or an in-office assessment, whatever meets a person's needs. We focus strongly on socioeconomic and psychosocial needs, and we connect clients not only to medical services, but as I said, community resources as well. And we follow up as needed. So I may speak to someone next week, and then they may call me 6 months from now and say, hey, Melissa, this is what's going on. Can you help me? And they will never be charged. We can also help with food, housing, transportation, medication support, choices counseling. Choices counseling, we are in open enrollment right now. You are probably being inundated with TV ads for open enrollment. We are non-biased resource that is able to help people make the right decision for them. So whether it's learning about Medicare versus Medicare Advantage, or how to navigate the plan finder and look and make plan comparisons, we can help do that in a non-biased way for people. We can also help people find out if they're eligible for these state programs or grants. Veterans liaison. If we think the healthcare system is a maze, The Veterans Administration is, I think, even a bigger maze. So we have a fantastic veterans liaison on our team. You can see her picture there. She is amazing. She's able to provide assessments in the same way, home, telephonic, virtual, whatever meets the client's needs. But she helps people answer questions such as, am I a veteran? Am I eligible for VA healthcare? Is my family eligible, and how do they access that? What about funeral arrangements or VA cemeteries? How can I display my military medals? She is able to answer all of those and so many more questions for our veterans and families of veterans. Dementia specialists. Dementia specialists are able to provide home, virtual, office, or telephonic visits as well. Also a free complimentary service. I like to say they're coaches. They do what I call dementia coaching. How to have difficult conversations with a loved one with dementia, such as, you know, how do I take the car keys away? Or to talk as a family about what are the best strategies to deal with sundowning or wandering. They can help with long-range planning as well. And they can also assess for safety concerns and evaluate, maybe it's time to look at another living situation for our loved ones. And they are also able to assist healthcare staff in providing education and strategies as well. The role of our transitional care nurse. So they are able to go out and do a complimentary, non-urgent, in-home or virtual one-time nursing visit. And when they go out, to say they are thorough is an understatement. I have been with them on their visits, and they are looking at medication management. They're looking at home safety. They can determine homebound status for a physician. They are able to follow up with someone who's had a recent emergency department visit. They can provide nutritional and educational counseling for disease-specific needs. So the patient must have an established relationship and have an order from a physician or an APRN or a PA who is willing to sign off on the orders and who has seen the patient recently. And the patient cannot be receiving any in-home certified nursing services. Home safety solutions. So I touched on briefly that there was a lot of different technological advances that can help keep people safe at home. So personal emergency response systems. There are many different models. Medication management. We see in the little picture there, that's a little flip dose, we call it, that has less than 10 meds, but you can get items that can carry up to 90 days worth of pills and distribute them as needed. There's fall and wander prevention. There's remote monitoring, home and fire safety, and there's even devices for the hearing impaired to enhance home safety as well. So many technological advances there. So where is the Center for Healthy Aging? Well, we are all over the state. We are in health centers in Bloomfield, Cheshire, Southington, and Vernon. We're in the hospitals, Bacchus, Hartford Hospital, HOCC Bradley Campus, HOCC New Britain Campus, Midstate, St. Vincent's, and Wyndham Hospital. And we're also in medical groups. I am in a medical group here in Torrington in the Northwest. And we also have geriatric providers in Bloomfield, Avon, West Hartford, Willimantic, and Bridgeport. So how do you contact the center? You can call our 1-877-424-4641 number. You will be connected with our department manager. His name is Andrew, and he will be able to connect you to any of the entities that you need to get in touch with that I've mentioned on our team no matter where you are in the state. We can also be reached on the web at hhccenterforhealthyaging.org. You can email us at centerforhealthyaging@hhchealth.org. And we are also on Facebook. We have a Hartford Healthcare Center for Healthy Aging page that you can like. And then we also have a private Hartford Healthcare Center for Healthy Aging support group, which you can also become a part of as well. So I am going to stop the share and I will go to the chat and see if there are any questions.
Yep. Wasn't speaking of technology and the changes and things. One of your questions in the chat. New favorite things to help people stay home and wasn't speaking about technology and robot changes and things. One of my new favorite things to help people affordable stay home and not worry about landscaping is robot lawnmowers to it, and it's a big stress relief. Finally made them where they're about it. They're easier to set up.
Yes.
It's kind of nice to, and robot vacuums. I'm a huge proponent of those because I hate vacuuming. We also got a robot mop for the office, and I'm very impressed. Mom's Meals is a good option for CCCI. So I guess I'll start some questions. Melissa, so are you seeing the kids bringing the parent in first, or is it actually the patient that's reaching out first?
It's really across the board. Sometimes I would say it's probably the children that are giving me a call first, but sometimes I will have a loved one that's reaching out for a spouse, a senior that's at home and having difficulty navigating the waters with the spouse, and they'll reach out. So it's really, every day is different. And that's one of the many things I love about the Center for Healthy Aging. No 2 days are alike.
So there's a question that came in is, what is a residential care home?
Residential care home is also known as a rest home. So that might be a place that somebody would go that needs care, but not a high level of care. They may just need some. Can you hear me?
Yep.
Okay, sorry. I apologize for my audio, everyone. Of course, today that had to happen. A residential care home is where somebody may just need medication support, or they may just need someone checking in with them, but they're at a fairly high level of functioning. And the benefit is it's at a lower cost than other options, at $200 a day, starting at $200 a day. And they do also accept Medicaid.
Where do you see care going in the future, Melissa? I know we're seeing staffing issues in every realm of care, whether it's home, facility, assisted living, nursing home. We're seeing changes in staffing and issues. Where do you see it going?
That's a great question. We really, really need more staff, and it's not just Connecticut. I mean, this is nationwide, but I'm seeing a lot more virtual platforms that are coming up, where people can access, telehealth, whether it's with their primary provider, and there's other platforms as well. So I think we may be seeing more of that coming out.
Yeah, I think it's going to get interesting. There's a number of companies working on robotic caregivers already. Apparently we'll see the first model out in 2027 to 2030. I don't know if it'll actually come as quickly as they say it will, but people think it will happen.
Wow.
But it's going to
never thought we'd see that, and here we are, Steve.
No, not at all. There's a question, what is the relationship between CCCI and Connecticut home care programs for the elders?
So CCCI is one of the agencies that does the case management for the Connecticut home care program. So the Connecticut home care program is case managed based, where you have a case manager who then implements an individualized plan of care for the individual. So CCCI is one of the agencies that provides that case management.
What do you think of the transition to more home care based for the state than facility based? Have you been seeing more people want to stay home since COVID?
I do, Steve. I think a lot of people, as we talked about, really, really want to be at home. And I think a lot of us really got to enjoy being in our home more, you know, having to slow down. So I do think that most people want to first remain in their home if at all possible. Yes. And I think that there was some fear, you know, during the pandemic about leaving one's environment. So yes, I think that's usually people's first choice, whether it's something that they can sustain or not. We might have to explore the options.
I think people have always wanted to stay home. I can't recall that many clients coming through going, oh yeah, I really want to move to a nursing home for that. You know, they all wanted home care. Just I think COVID really locked in that it's doable and feasible to get that level of care at home, and we've improved access to it and made it so that it's a comfortable environment for people to stay home, because moving isn't always an easy thing to begin with. And for a lot of people, their house is their castle. We work for it, we work on it, we live there, we raise our families there. And I have clients who've had their house 50 plus years. They're not going to leave it at any time soon. So
absolutely,
that is the key. So there's a question, what type of home care services are paid for through Medicare?
Only short-term skilled services.
Yeah.
So when we were talking about that certified skilled nursing in the home, think of, I was in the hospital and now I'm transitioning home, and maybe they've set up visiting nursing services to carry on and provide some skilled nursing. Maybe I need wound care. Maybe I have a change in medication that needs to be monitored for a short-term period. Maybe I need physical therapy or occupational therapy. Think short-term, and you have to be homebound. In other words, you're not going out to the casino. You're home, only going out for medical appointments.
Yeah, unfortunately, Medicare doesn't cover everything people think it does.
No, not at all.
I know there's been proposals for it to increase coverage, but I don't see it happening. It's a budgetary issue. So unfortunately, it's still just insurance at the end of the day.
And speaking to that, Steve, I think a lot of times people go into a skilled nursing facility and they are under the assumption that they get that 100 days. And that is not necessarily the case. You come into a facility, maybe you've had a 3-day qualifying hospital stay. Many of you have heard about that 3-day qualifying stay. You go into a facility and you're covered under Medicare or another health insurance as long as you're meeting that need for skilled services. Once you reach the goals that the physical therapist has set for you or the occupational therapist has set for you, and you've maxed out or reached your maximum potential, and it may not be what you think is your potential, it's what their goals are for you, they can't justify Medicare covering. So a lot of people come in and they say, I was told we get 100 days. And that the potential is there, but you have to have the need for skilled care.
And then the question also comes in is, does the Medicare supplement pay for any of the more intensive services like home health care or skilled nursing facility?
Not really.
No. It supplements the cost of care, but it doesn't do anything else. And it'll be interesting to see where it goes, because we do have more people going on programs like Medicare and Medicaid now, where we're aging into them, and we're going to have different coverage levels and considerations, but it's unfortunately under the standards, it's going to be very limited for the time being.
Absolutely.
There's question is, there's a regulated 100 days. After 21 days, you're responsible for some payments. Is that correct?
Yes. Yes,
Yeah,
and there's a co-insurance, and I apologize. I've been out of the skilled nursing realm for 3 years now, and I'm not recalling what that is, but there is a copay after day 21.
And the copay goes up year to year. There are variables, and that's also where having a supplement is useful, is because the supplement can cover those things. And that's why it's important to look every year. Connecticut is a guaranteed issue state. So if you do switch policies, even if you have an illness, you're still guaranteed to be able to get a new policy. They can't withhold coverage from you. So it's important to look every year at what medications you're taking. And I put them through every year, and then looking at whether there's a need to change the supplement. Usually there isn't, but every once in a while there can be, because there might be a big coverage change or something that's not offered anymore. But it's really important to explore it every year. And one of the interesting things about Medicare is, unlike any other insurance that I know of, Medicare agents get the same premium no matter what. If you work with a Medicare agent, they all get the exact same amount from every single company, no matter what plan you get, because it's designed to prevent you from being sold something you don't need. Someone said you need a supplemental or Medigap policy. Yeah, I think most people do. Unfortunately, a lot of people don't get them, but they do need them. We see this a lot. It's definitely important, especially with like durable medical equipment coverage.
Correct.
So we only got a few more minutes for everyone. So Melissa, any final thoughts or things you want people to take as their number one takeaway?
I think the number one takeaway, and I've said this throughout the day, and I just can't say it enough, is, well, a couple things. Planning ahead. I tend to be a procrastinator on certain things, but this is something, when you are a caregiver, if there's one takeaway that you can take away from this today, would be, we all need to have a plan B. We all want, like Steve said, we would all love to remain in our homes. We would all love our family members to remain at home where they've created their life's memories and they've worked so hard. But we have to have that contingency or plan B for the what if, if plan A fails and we can't, either our medical needs exceed or the environment is not safe, what is plan B going to be? And that's going to be different for everyone. So sitting down and having those conversations, and they're courageous conversations, because it's not easy stuff to talk about. That would be number one. Number two is speaking to your family. I said this in the lunch panel, I think. You don't know until it happens, and everyone in the family isn't going to agree on everything. And I have one sibling only, but there's families I work with that there's six siblings, and they all have different ideas about what's going to be done for mom. So if you can sit down before a crisis, before crisis mode, before mom's in the hospital, and talk about, your strength is this, maybe you should help with the financial. I know a little bit more about the healthcare system, maybe I'll deal with this. So not always easy again, but that would be a takeaway that I would suggest.
I always like to say you need a plan A, a plan B, and a plan C.
Yeah, plan C.
Plan A when things are going well. Plan B if you need something's really going on, and plan C when just everything hit the fan because it's bad. But you still got to know what you're doing. So someone said you don't need to have, or do you need a managed, with a managed care plan, do you need a supplement? I think you're talking about an Advantage plan, and the answer is no, because
no, not with an Advantage plan. Correct.
Sometimes Advantage plans don't always work the best depending on what you need. They're really, really good when you're healthy, not always the best when you're sick.
You got it.
With that, I think we're going to end this session because we're going to go everyone back to the main room. But Melissa, thank you very much. We appreciate it. It was a very good session.
Thank you for having me. Thank you, everyone. Have a great weekend.
Thank you.